Clinical Judgment, Week 3. This week, our case study, we have an 82-year-old female who's in the emergency department following a fall at home. She's confused and is seeing bugs crawling on the walls. The client's daughter reports the client has been having urinary incontinence, urinary frequency, and nocturia for the last several days. Okay, so what findings are going to be relevant or most important at this time? These are what you have to look at. The client is alert to and oriented to self only. She has a heart rate of 68 beats per minute. It is regular. Her blood pressure is 162/86. Breath sounds are clear in all lung fields. She has active bowel sounds times 4 quads. Her temp is 98 degrees orally. Respiratory rate is 20 per minute. She does have bruising to the left upper arm. She is independent and lives at home alone. She has a history of urinary incontinence, frequency, and nocturia. And her oxygen saturation is 95% on room air. So again, what do you find concerning at this point? Okay, let's move on to slide 2. This is what I found concerning. She's alert and oriented to herself only. So what could cause that? Well, we know there's several medications that can cause confusion, can cause that altered mental status. We know that hypoxia can cause confusion. Infection. In fact, infection in the older adult is often exhibited by confusion, or there may be fluid or electrolyte imbalances. She has a temp that's 98 degrees orally. Why would I put that as being concerning? Remember, I stated in last week's video that sometimes we can have a normal finding, but it's still pertinent to the particular case study that we're working on. Well, in this case, a normal temperature, we know that our older adults may have a normal to low temperature with infection. So in this case, this might be pertinent for her. I also chose bruising to the left upper arm. This could be because of her fall. It could be that she just bumped into something. We know that older adults tend to bruise with very minimal injury. She may also be on anticoagulants that would cause excessive bruising. The history of urinary incontinence, frequency, and nocturia. Well, she may have an infection. Maybe she has an irritable bladder. This could potentially just be because of the aging process. We know as adults get older that they tend to lose some of that muscle control. Although incontinence is not a normal finding, it's not uncommon. So we may begin to see some of that incontinence with that. However, it does not necessarily explain the frequency and the nocturia. The elevated blood pressure. We know that there are a multitude of things that could cause an elevated blood pressure. Maybe pain, agitation, stress, restlessness. Maybe she has an infection and she has stress from that infection. Confusion, depending on how agitated she is. Maybe she has an overall diagnosis of hypertension. So those are just a few. So what are potential complications from the cues that were identified previously? Or what are consequences of these particular issues? We know that with the elevated blood pressure, the two main complications would be a cerebrovascular accident or an aneurysm. The fact that she's alert and oriented to herself only, this is a huge safety risk. Again, the temperature of 98 degrees, we can't base potential infection on temperature in the older adult. So potential complication would be sepsis. Bruising to that left upper arm, she could develop a hematoma. Hematoma is going to be more than just bruising. It's going to be a collection of blood underneath the skin. And if that collection of blood is large enough, it could actually begin to compress the blood vessels and the nerves and could potentially lead to compartment syndrome. We could also have a lack of peripheral circulation. History of urinary incontinence, frequency of nocturia, complication, definitely a safety risk, but also sepsis. So what is the most likely explanation for what's going on with this client? Well, she probably has some delirium going on. Remember, delirium is a transient issue, often caused by infection or some type of stress, especially in the older adult. Maybe she has the UTI. We know that UTI, one of the common symptoms that are seen with the UTI, is going to be confusion. Again, we have to understand that she does have a risk of urosepsis. She is definitely a safety risk. So, what are our three priorities for this client based on what we determined is going on with her? We know that we need to reduce her blood pressure. We need to eliminate infection, and we need to provide for her safety. Expected outcomes based on the determined priorities. Well, blood pressure within normal limits, urinary patterns within normal limits, in other words, decreased or no incontinence, no frequency, and no nocturia, and no injury. So now what are we going to do? We need to generate those solutions. What members of the healthcare team are going to be involved in this case? Well, we definitely need lab because we're going to be running a UA most likely, doing a culture. The doctor, the nurse, those kind of go without saying. And of course, aides, we can't forget the aides. They're the ones who provide probably 90% of the actual physical patient cares. We could also include maybe physical therapy if she's weak because she took a fall, right? We need to make sure that her strength is adequate, that she has ambulation assistive devices if they are required, etc. Okay, so is there anything that should be avoided or would be a contraindication? Well, we definitely want to increase fluid, so we would not do fluid restrictions. Uh, Fluid restrictions could only increase the symptoms of a UTI and could potentially cause dehydration, which would only increase the symptoms the client is having. So, different actions that would be necessary to meet the expected outcomes. Well, just what I said, we need to increase her fluid. Definitely reorient her as necessary. If she has an infection, urinary tract infection, which it does sound likely, then we need to administer antibiotics. We need to make sure that she is doing appropriate perineal hygiene, and if she is not, we need to educate her on the proper methods. We need to observe her frequently. We need to assist her with ambulation, provide for frequent toileting to help minimize incontinence, definitely monitor her vital signs. So as we look at priorities, again, we need to determine if there is anything that's potentially limb or life-threatening, and we need to implement those first. So we're looking at our priority issues. What do we need to do? Well, to make sure her blood pressure is within normal limits, we would monitor vital signs and potentially administer some antihypertensives. With the urinary patterns, getting those within normal limits, we need to increase that fluid intake. We would need to do some labs, again, the UA, the culture, and potentially administer antibiotics. Usually we'll start off with a broad spectrum antibiotic until we get results of the culture back to determine if there is an antibiotic change that we need to make that would be more effective in killing off the bacteria. And as far as no injury, frequent observation, reorientation, and assisting with ambulation would be very important. So did we meet the expected outcomes? If they were not met, what do we need to do to achieve them? What issues do we need to tweak? Uh, or do we need to change or eliminate some of the interventions that we have outlined? So now we're going to look at our priority client again. We have a client that's reporting a migraine headache, pain 8 out of 10, nausea, vomiting. We have a client with a goose egg to the occiput, report of a headache, is alert. We have a client talking and becomes very drowsy, then does not respond verbally. We have a client who wakes up postoperatively with confusion and hallucinations. Well, let's look at each one of these. We have that migraine headache, that severe pain, nausea, vomiting. Nausea, vomiting often occurs with severe pain, and having pain that severe with a migraine headache is definitely not abnormal. We have a client that has the goose egg, so we have some type of a head injury. It might be very minor. Report of a headache. Well, we expect there to be a headache with a head injury, right? But the client's alert, so at this point, seems to be doing pretty good. We have a client who's talking, then becomes very drowsy, then does not respond verbally. So it sounds like we may have a change in the level of consciousness. And then we have a client who wakes up postoperatively with confusion and hallucinations. Anesthesia and or any pain medications that may have been administered can all cause this. So the correct answer would be number 3. Remember, a change in mental status is definitely one of our priorities behind our ABCs. And now let's look at some of our NCLEX style questions. The nurse is assessing a client who is brought to the emergency department for altered mental status. In the absence of family members or witnesses to give a history, what does the nurse do to identify two conditions that could mimic emergent neurologic conditions? First of all, we need to determine what the question is asking. This question is actually asking what are the issues that can cause emergent altered mental status. Your responses: check skin turgor and perform a bladder scan, check blood glucose and oxygen saturation, observe for jugular vein distension and pitting edema, observe for jaundice and abdominal distension. Well, these things are all good assessment things. We wouldn't necessarily perform the bladder scan on just anyone during an assessment. However, the two things that could cause an emergent issue with mental status would be a low blood sugar or a low oxygen saturation. So the correct answer is B. Next question. The nurse is working in a long-term care facility. Which circumstance is cause for greatest concern because the facility has a large number of residents who are developing urinary tract infections? What is this question asking? To be perfectly honest, we need to know what are causes of UTIs. Your choices are: residents are not drinking enough fluids with meals, unlicensed personnel are not assisting with toileting in a timely fashion, a large percentage of residents have indwelling urinary catheters, many residents have severe dementia and functional incontinence. Now, understand that it says the greatest concern. So all of these are potential causes of UTIs. We need to know which response is a concern because something is being done incorrectly in this instance. So, correct answer would be C. We have a large percentage of residents with indwelling catheters, and now we have a lot of UTIs. So, obviously, we're not doing appropriate perineal care, or we have improper insertion technique. Next question. The nursing student sees an order for a urinalysis for a client with frequency, urgency, and dysuria. In order to collect the specimen, what does the student do? What is this question asking? Basically, how do we collect a urine specimen? Your choices: use sterile technique to insert a small diameter 6 French catheter, instruct the client on how to collect a clean catch specimen, tell the client to urinate approximately 10 mL into a specimen cup, take the urine from a bedpan and transfer it into a specimen cup. So understand that in response A, a 6 French catheter is very, very small. The average catheter size for adults is usually at least a 14 French. The specimen is usually going to require at least 10 mLs, but usually there's much more. Taking urine from a bedpan is usually going to be contaminated, so it's not going to be like the clean catch. Definitely potential of having additional bacteria there. The correct answer is going to be B. Next question. An older woman is brought to the clinic by her husband. She went out to do some gardening, but a neighbor found her walking aimlessly down the street. She is currently just like herself, but the client cannot explain what she was doing or where she was going. Which questions will the nurse ask to assess cognitive changes in this client? Select all that apply. What is this question asking? Well, I don't know about you, but I want to know what is involved when we're talking about cognition. Response 1. Have you noticed any forgetfulness? For example, misplacing your key? This would be a great assessment question to help determine if there's any permanent cognitive changes. Has there been any memory loss, such as not remembering a recent conversation? Again, a great assessment question. I would definitely ask something along this line. Number 3, are there any changes in your ability to make judgments, such as taking medication? Again, another terrific assessment question as far as cognitive abilities and cognitive history. Number 4, have you noticed any problems with walking, such as the loss of balance? This does not assess cognitive ability, so this would not be an appropriate choice. Number 5, are there any changes in your abilities to do a task like balancing your checkbook? This would be a great question to identify cognitive abilities. And number 6, what were you thinking about while you were walking down the street? This will not tell us anything about cognitive ability.